shallow. All right? You have to actually train yourself to breathe deeply. The deeper you breathe, the more you move your intercostals and your diaphragm, and therefore the more return of the venous system in your upper body to the heart. That's kind of cool if you think about it. When we think about this increase of meeting the demand, like I said, to meet the demand, that means your heart rate's going to go up. Because if I'm starting a physical activity, well, one of the things that's going to happen, my heart rate's going to increase. If my heart rate's increasing, my muscles are moving, I'm moving more of the blood through my body. So how do we get that? We take a pulse. Many areas of the body, you can take a pulse. Some cases, you have to allow for where you took the pulse. So say, for example, you took a pedal pulse in the foot. Write that on your chart, okay? Because whoever comes behind you needs to know. Well, they might look at it, if you didn't write pedal pulse, they're going to look at the number and think something's wrong, when in reality it's perfectly normal, or could be perfectly normal. So always, to make sure you do that. When the heart rate is above 100 beats per minute, under normal circumstances, okay, because the norm is roughly around 70 to 75, okay, so above 100, they say is tachycardia. Below 60, which is our norm values here, okay, would be bradycardia. Any idea what those numbers have to be for them to be indicative of other processes that will be affected in the body? When you're doing a physical activity, your heart rate, like if you've conditioned and you've been training, say you're a marathon runner or something like that, your heart rate could possibly go up to 150, 160, depending on the activity you're doing. But that's okay. You've conditioned it to do it. For me, not conditioned. I get up to 150, 160, I'm in trouble. I need to get to hospital. All right? Usually, the numbers for being too high, they usually look at pulses over 200. All right? That means there could be other issues. Need to get an EKG, see what's causing something to go wrong. If you go below 60 beats per minute, things are wrong again, because you're not getting blood moving through the system, meaning you're not getting nourishment to the tissues, and tissues are going to die. So both are something to be concerned with. When the heart rate is too high under something abnormal, not if you've conditioned and trained, okay, but under something abnormal, once again, you're still not getting blood to the tissues. The blood is moving so quickly through the heart doesn't really have time to fill properly, to expel properly. And therefore, once again, you're not getting blood to the tissues, therefore no nourishment. So both are detrimental to the physical body. Now, our heart rate, heartbeat, okay? We have something called chronotropic effects. Chronotropic means time turn. You are affecting the timing of that heart rate. We can have effects on our heart rate from our autonomic nervous system. Remember, the heart is viscera. Therefore, it's innervated with sympathetic and parasympathetic fibers. They do not they do not make the heartbeat. I keep trying to say that because our heartbeat is set by that sinoatrial node. Does everybody remember that? So, this autonomic nervous system with the parasympathetic and sympathetic, in our medulla oblongata, part of and that reticular formation that goes through it, we have an area termed the cardiac center. It's getting input from many different areas of the body. Do you guys remember proprioceptors? What are they? Where are they found?
Aware of space.
My place in space. Found in like those little areas of the muscle that are specialized fibers. Okay? Well, wait a minute. Why would my place in space, meaning standing, sitting, walking, tumbling, up, down, forward, back, twisting, why would I need to be concerned about that and my heart rate?
I guess it could affect your heart rate if you're in different places.
Yes, different positions affect the heartbeat. A person that goes from lying down to standing up too quickly can faint because their heart can't meet the demands of the blood needed for the rest of the tissues that were inactive. Baroreceptors, do you remember those?
Blood pressure.
Do you remember where they were located? Yes, in those carotid arteries that come off the heart. Okay? Chemoreceptors, once again, vessels off of the heart. Emotions. Do those not affect heart? Of course they do. Anger, whatever the case might be. My hypothalamus. All those little hormones. Oh boy. Yeah, they definitely affect heart rate. So many things affect our heart rate. The goal is to make sure that the two of them can work together, and in doing so, if the sympathetic raises my heart rate, hopefully parasympathetic brings it back down. And between the two of them, I kind of have my normal firing rate from the SA node. Because they innervate, especially sympathetic, innervates the SA, but it doesn't cause the firing. The firing is from the SA node itself, but it can affect it. It could go higher. Hopefully, parasympathetic will say, whoa, all right, and we can stay in vagal tone, meaning the norm, roughly the 70 to 75. Chemicals. Now, this would be chemicals in our blood. Definitely my hormones. Most definitely. Stuff that I take in. Nicotine, for example. What does that do to the heart rate? It increases it. People tend to have, the cigarette thinking, oh, it's calming me down. Actually, it's constricting and increasing the blood, the heartbeat, and blood pressure. Thyroid hormone. People who are hyperthyroid have a higher heartbeat. Hypothyroid is lower. Caffeine, so many things that can cause an effect. ones that are going to definitely be seen once you get out into the field. And you're probably going to see these terms a lot. Kalemia, calcemia. You need to learn to keep the two separate because you will see these terms, you will hear these terms, you will talk to other peers that you work with about these conditions of the patient. Kalemia is your potassium. Wait a minute. What? Calcemia is kind of, given calcium. Why am I concerned about either of these ions? Do what? They are my electrolytes. What do they make muscle do? Contract and relax. Two conditions that are very common in people who are going to have health conditions. Note that I'm not saying just heart conditions, because other conditions in the body can affect the activity of the heart, okay? Endokalemia, meaning hyper or hypo, too much, too little. One of the things that usually happens when people present with certain issues, hopefully doctors will do, or that they'll order blood work. Blood work comes back. It's now your job and their job to understand those results, which is why I'm trying really hard to get you all to understand at the cellular level. Because if these ions are incorrect, and if they are affecting contraction of muscle, note my terminology. How many types of muscle? 3. Therefore, it would affect stuff going on in my skeletal muscle. It will affect my viscera, organs, and my heart. Does that make sense? Okay, because everything about these muscle cells is dependent on these ions. So too little, too low. There are presenting factors that the patient will exhibit. Because they're common, those effects are very common. They're pretty much the same across the board for any patient. Sometimes you might have to dig a little deeper, okay? But for the most part, a lot of the symptoms are the same. Too much potassium, in the case of the heart, the myocardium, which is my cardiac muscle, okay? It's less excitable. Just like in skeletal muscle, it's opposite of what you think it should be. Because if it's too much, you think it should be doing too much. It actually does the opposite. I won't get into the reasons why, but too much potassium can actually slow the heart rate to the point of it stopping and death ensuing. Too much of the, I had that backwards, didn't I? No, too much, too little of the potassium does the opposite. In the case of potassium, it's going to be difficult to stimulate the heartbeat. So that actually means the heart actually beating at all. It's not just